favorite way to describe holistic dentistry is whole body dentistry. So we do not separate the head from the rest of the body. This is all connected, and really that is well accepted amongst the dental community when speaking about periodontal disease, how it's affecting heart conditions, diabetes, and how that is tied into periodontal disease and other types of oral health. But for some reason, when we start talking about how metals affect or root canals affect, then suddenly the head gets disconnected again from the body. So, holistic dentistry is not a specialty. Though some people would like to categorize it into a separate group, it really is those of us practicing holistic, biological, integrative dentistry. It goes by a lot of different names. Really what we're achieving is quality dentistry, whole family dentistry. We see all ages, we do all types of dentistry, but the paradigm shift is the key, and that is that we are attempting to tread as lightly on our patient's bioterrain as possible. We do that by being very careful with the types of materials we choose to use for each patient. Many of our patients select to have biocompatibility blood testing done, especially if they've had a problem in the past with allergies or bad reactions to some of their dental treatment. We offer them a kind of a safe haven where they can come and express their concerns about what is used in the products that we'll treat them with, and we answer all of their questions. We're comfortable with that, and they're welcome at our office, and we do our best to minimize any kind of poor reactions that may happen from using materials they would otherwise react negatively to. So that's one important thing to us, making sure that what we are putting in there is not only high quality and well done, but actually is not going to negatively affect our patient's health. Unfortunately, for biological dentists, a lot of us feel there's just way too many studies that have been done since the 30s even that show metals, especially mixing metals in the mouth, to be dangerous to our health with the battery situation that can be set off. The galvanization has been proven, so that's one of those issues that is argued, but it's very proven for years that you mix different metals in a solution, and like saliva in the mouth, and it makes the perfect environment for a battery. So we believe having a battery type of effect going off so near to the brain can negatively affect our health in multiple different ways, and so we avoid placing metals in the mouth. And there are quite a few other areas where we differ from the American Dental Association, stamp of health, for lack of a better word. And root canals, for example, many patients come to us for alternatives to placing root canals in their mouth to keep their tooth that is dying or dead. And one of our, kind of ways of explaining it that we like to talk to patients about is, and to others that are questioning why we wouldn't do a root canal to keep a tooth. And our answer is, where else in the body do we take an organ, and tooth is an organ, that's not an argument, that has a nerve and a blood supply, and remove that nerve and blood supply, basically mummifying that organ, and then allow it to stay in the body. There is nowhere else that we medically would allow that to happen. Somewhere along the way, when we decided to use that as an opportunity to keep teeth in the mouth, we forgot to ask, even if you can do that, should we be doing that? Should we be taking something that was alive and allowing it to remain in the body without a nerve and a blood supply? And so there are some dangers to that. Bacteria that ends up turning to anaerobic bacteria and releasing toxins into the body. And again, many studies out there on this, but for whatever reason, just not very accepted by the American Dental Association. So we give patients an alternative to that. Also, just avoiding as much as possible the materials that have BPA byproducts, BPS, BPE, all of these that people are becoming more aware of, and they're careful about their bottles, and they're careful about their plastics they use in their life. And unfortunately, a lot of the good composites that we would normally choose because they would last long, or they would do a a good job and look nice in the mouth, you have to again ask, even if it looks nice and lasts, what is the effect on the body for the long term? So we try to find those products that have been dedicated to helping dentists find better options that are more healthy, so that do not have the BPA and BPS byproducts.